On Monday, October 30th, 2017, Cook County Board President Toni Preckwinkle was joined by 8 members of the Illinois Congressional delegation to announce the beginning of the Affordable Care Act open enrollment season, starting November 1st through December 15th of this year. President Toni Preckwinkle and others expressed the importance of signing up and the overall benefits of the ACA for residents of Cook County.
We're here today to highlight the Affordable Care Act's open enrollment season, an effort that is more important this year than at any other time since the enactment of the Affordable Care Act. The Trump administration, make no mistake about it, is actively subverting the ACA and the progress we've made by removing nearly all funding for open enrollment, public service advertisements, and on-the-ground enrollment efforts. The impact of these attacks on the exchanges is obvious, but what we rarely talk about is how decreasing public awareness to open enrollment impacts Medicaid. What we know from our health and hospital systems is that Medicaid membership goes up when people discover through open enrollment that they are eligible to receive benefits through Medicaid expansion. In Illinois, 1 out of every 4 residents is on Medicaid. In Cook County, more than 300,000 people have insurance for the first time because of Medicaid expansion, including nearly 140,000 people who are part of County Care, our own Medicaid expansion managed care program, a number that could double next year. We're unwilling to go backwards. We have a moral and fiscal responsibility to ensure that all our residents have access to quality health care and are not using emergency rooms, like here at Stroger, as primary care clinics at a high cost to our taxpayers. I don't want to be standing here next year knowing we did not do enough to sound the alarm on attacks on the Affordable Care Act. First, it's the Trump administration defunding enrollment PSAs, those public service advertisements, but next it could be Congress starving Medicaid appropriations while no one is watching. Well, I'm here today, flanked by these important people, with a message for Washington. We're watching, and we will be vigilant every day until these attacks on our most vulnerable residents stop. We owe them that, and we owe it to our taxpayers.
The Affordable Care Act is alive and well, but if it's struggling, it's because President Donald Trump has his hands around its throat. They've done everything they could in this administration from the first day to stop the Affordable Care Act and to convince Americans not to be part of it. The first day in office, the president's first executive order was to every federal agency saying, play down the Affordable Care Act, don't cooperate, find ways to stop it. Then they came through and shortened the enrollment periods so that people had less time. They eliminated the money for advertising so that people weren't aware when the eligibility period would start. They cut the money for navigators who would be around for people who would call on the phone and say, can you answer a couple questions about my health insurance? And on top of that, they started running negative ads paid for by the federal government, basically saying, don't sign up for the Affordable Care Act. That's what they've done to try in every possible way to sabotage the Affordable Care Act and what it means to Americans, but it's not going to work. 350,000 people in this state depend on the individual marketplace. And here's a little insight. 61% of those people will be eligible for a subsidy on their premiums and pay $100 or less a month for health insurance. 61% of those who will be eligible will be paying less than $100 a month. It's based on your income, and for people regardless of income, there's usually a helping hand so that they can pay for the premiums and get quality health care. We've had a battle in the Senate twice now. Trump Care has failed by 1 Senate vote. 1 Senate vote. We're not letting our guard down, but we want to say to Americans, stand up and be counted. Know that this health care is worth buying. Know that it protects your family. Know that it's alive and well, and we're fighting to keep it alive. Thank you.
For more information on the Affordable Care Act enrollment period, visit www.getcovered.illinois.gov or call 866-311-1119 for assistance while shopping for insurance plans. This has been a Look Inside Cook County.